This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Okay, to err is human, but for healthcare providers, keeping patients safe is the top priority and requires a collaborative effort between the medical team as well as the patient. And that's the message that's being sent loud and clear during Patient Safety Awareness Week. With us this afternoon, Dr. Chris Snyder, who's the Chief Quality Officer and Hospitalist at Peninsula Regional Medical Center. He is here to talk with us about the importance of this week. It's good to see you, sir. Thank you for joining us.
Thanks.
So this is a nationwide effort.
Yes.
And PRMC is taking part.
Yes, we are. We do every year. Have a lot of safety initiatives going on throughout the year. Obviously, we don't just do it for a week, but this week is a little bit of emphasis on what we've done in the past and some of the things we're focusing on, like medications.
Now, PRMC was recently graded on its hospital safety.
Right.
And?
So health grades, we did very well, top 5% in the country out of about 4,500 hospitals nationwide.
Congratulations,
we're in the top
that's fantastic.
250. Well, we're excited. We like getting good grades, but
right.
we also like practicing safe medicine too. So
that is terrific. That is awesome. Now, it's not just as far as safety for patients inside the hospital. It includes the patient safety outside of the hospital.
Yeah, actually in the hospital, if you think about it, when you're in the hospital, you're in an environment where you should be safe. To err human was done on hospital-based safety concerns where folks were harmed while they were in the hospital with pharmaceuticals, with whatever. We do
of course, unintentionally.
We absolutely, and we do some pretty dangerous things. So it's been an emphasis over the last couple decades to really have a focus on medication safety, for example, and ensuring folks when they leave the hospital leave with meds in hand. That's a new project we started a couple of years ago where we actually encourage patients to get their pharmaceuticals short term right after the hospitalization, which is typically the highest risk time frame because they've left the nest, right you say, and we have to ensure that they can go home and manage their care with limited access and resources.
And obviously you guys have done a great job with that, so congratulations again.
Well, thanks.
That's spectacular. Do you feel like there's a lot of work left to do?
Oh, always. Yeah, you always have to have your eye on the target with safety. Things change and patients change and decisions that are made change. So we really do have our eye on the target. We're constantly focusing. This week we have pharmacists, for example, sitting in our lobbies, which will help answer patients' questions about pharmaceuticals, med reconciliation, et cetera. So that's just one of the many initiatives. And the pharmaceuticals are probably one of our biggest high-risk areas nationwide. So it's definitely an emphasis for us every day, every patient.
Is there something the community can do to help?
So the community just communicating with their PCPs, following up with their providers, utilizing resources like pharmacists, nurses. We actually have a phone call that's automated. Every patient that leaves the hospital starting in January gets a phone call at discharge. That phone call within 24 hours gives them a menu to ask questions. Are you having a problem with your meds? Are you having a problem? If so, hit this button, and a nurse will then call them back and engage them if needed. So yes, there's a constant movement towards that handoff process at discharge.
Wow. Well, again, thank you for everything you do, Dr. Chris Snyder, Chief Quality Officer and Hospitalist at Peninsula Regional Medical Center.
Yep.
Thank you for talking to us.
Thanks, Jim.
Wonderful to talk to you.